What is lymphoma and what are the facts and myths that are existing in the community about lymphoma? So, lymphoma is nothing but a cancerous condition. It is a type of blood cancer that happens in lymph nodes or glands that are located in various parts of our body. Normally, these glands or lymph nodes they play a key role in making sure that infection does not spread from one part of the body into the bloodstream or to the other organs in the body. But when the check mechanism to make sure that cells don't go out of control multiplying sort of goes out of place because of various reasons, it causes this condition called lymphoma, where patients can have various symptoms, including but not limited to enlargement of glands. So there can be large glands in the neck, it can be in the armpits, it can be in the groin or in the thighs. So it causes enlargement of these glands. Can also cause recurrent fevers, persistent fevers, significant night sweats, which means waking up in the night, soaked with sweat, a lot of unexplained weight loss, reduced appetite, reduced energy. So these are most of your salient symptoms that happen with lymphoma. Now, that we have covered what is lymphoma, what are some of the facts that we should know about lymphoma? So, and what are some of the myths? Of course, that's also important. So I'll start with the myths. So usually the way to diagnose lymphoma, or if a patient has lymphoma, is when somebody has a lymph node or enlarged gland, we remove the lymph node. It is called as excisional biopsy. So there are two ways to doing a biopsy. One is just putting a small needle into the lymph node and getting a sample of it and testing it. The other way is to take out the entire lymph node. What's important for diagnosis of lymphoma, and if a patient really has it and what kind it is the needle test, or what we call fine needle aspiration cytology, is not enough for diagnosing. The entire lymph node has to be removed and sent for appropriate testing to ensure that the patient has or does not have lymphoma. The other fact, or the other myth that is associated, is it can spread by biopsy. So when we recommend, when you see a patient with an enlarged lymph node and we ask the patient to undergo biopsy, their first reaction is no. If you put a needle into it, or if you try to take it out, it might go into the blood and spread to other organs. That is an absolute myth, because lymphoma, when the excisional biopsy is done, just the biopsy, the lymph node that is affected is removed, in toto along with the capsule, making sure that the cancerous cells, even if they are there inside the lymph node, are not spilt out into the blood and they don't go to the adjacent or next surrounding organs. One more myth that I've heard is children cannot get lymphoma. So, as I have mentioned in some of my earlier videos, there are two types of lymphoma: Hodgkin's and non-Hodgkin's lymphoma. Lymphoma, of course, is not as common in children as it is in adults, but lymphoma also occurs in children. Of course, the more common lymphoma that occurs in adult children as compared to adults is non-Hodgkin's lymphoma. There are two types, Hodgkin's and non-Hodgkin's, of which the Hodgkin's lymphoma is a much more curable variety and does not require very aggressive treatment to be able to bring about cure. Whereas the non-Hodgkin's lymphoma again comes in two varieties. It has T cell non-Hodgkin's lymphoma and B cell non-Hodgkin's lymphoma. Your T non-Hodgkin's lymphoma is something that requires more aggressive treatment and can be a little difficult to achieve cure in. However, your B cell lymphoma is something that with chemotherapy and sometimes radiation can definitely be cured. So again, to answer that myth, children can also have lymphoma, although it is not as common as lymphoma that is seen in adults. Once lymphoma happens, it cannot be cured. It's a blood cancer, so it is like a death sentence. So that is one of the other major myths I have seen associated with patients who have a diagnosis of lymphoma. So the diagnosis of lymphoma in itself is not a death sentence, for the simple reason that, as I mentioned, there are two varieties, Hodgkin's and non-Hodgkin's. So Hodgkin's lymphoma in adults and in children actually has a very good outcome. So if chemotherapy is started at the right time, if the staging of the lymphoma is done in the correct scientific way, and the right lymphoma is diagnosed along with just chemotherapy, at least about 75 to 80% of Hodgkin's lymphoma can be cured. There is, of course, a chance of relapse or recurrence of disease with any lymphoma, just like with any other cancer. But Hodgkin's lymphoma is one of those that even when it recurs, there are multiple modalities that can be used to treat Hodgkin's lymphoma. So as medical oncologists or hematologists, we say that Hodgkin's lymphoma, the cure you're looking at for adults is upwards of 80%. It can be anywhere between 80 to 90%. In children, you're looking at very similar numbers. Actually, it's even higher. So, Hodgkin's lymphoma in children is curable up to 90 to 95%. When it comes to non-Hodgkin's lymphoma, that is also curable, but your rates of cure or your outcomes are slightly lesser compared to Hodgkin's lymphoma. So, non-Hodgkin's lymphoma, the B cell variety, tends to be more responsive to chemotherapy, and you're looking at response rates of around 70 to 75%. If it's T cell Hodgkin's lymphoma, then the response rate is a little lesser, and we're looking at around 65 to 70% of cure. But in a nutshell, it is not that lymphoma cannot be cured. It is just that it depends on what type of lymphoma it is. Is it picked up at the right time? Is it staged in the right way? And has the right treatment been initiated for it? So, as a hematologist, I would like to stress on the fact, as I have mentioned through my entire video, do not be scared about the diagnosis of lymphoma. Yes, it may be blood cancer, but if the right help is sought out and the right specialist, which is a hematologist, is the person who's treating a patient with lymphoma, it is a very curable or at least a controllable disease. And with the help of recent scientific advances, including chemotherapy, radiation, your targeted therapy, immunotherapy like rituximab, and sometimes autologous or allogenic stem cell transplants, lymphoma can definitely either be cured or kept under significant control. Please feel free to reach out to me if you have any questions regarding either the diagnosis or treatment of lymphoma. I'm Dr. Neema Bhat, hematologist and pediatric oncologist. Thank you.